Hello everyone, myself the Docsaab diary, and today I am going to teach you about the CURB-65 score, a vital tool in clinical practice for assessing the severity of community acquired pneumonia. This presentation aims to provide a clear understanding of its components, interpretation and practical application, ultimately helping us make better informed decisions for patient care. Let's start it. So, what exactly is CURB-65? It's a clinical prediction rule, an acronym used to assess the severity of community acquired pneumonia. Its primary purpose is to help us stratify patients based on their risk of mortality and guide decisions on whether they can be treated at home, require hospitalization, or even intensive care. It's a quick and effective way to standardize our initial assessment. Let's break down the acronym. C stands for the confusion, specifically new onset disorientation. U is for urea with a blood urea nitrogen level greater than 7 mmol per liter or 19 milligram per deciliter. R represent a high respiratory rate, 30 breaths per minute or more. B is for blood pressure, indicating hypotension with a systolic pressure less than 90 mm mercury or diastolic blood pressure 60 mm mercury or less. And finally, 65 signifies a age. For patient 65 years or older, each of these criteria present scores 1 point. Interpreting the CURB-65 score is straightforward. You simply add up those points for each criterion present. The total score can range from 0 to 5. A higher score directly correlates with increased disease severity and, importantly, a higher risk of mortality. This simple scoring system provides a rapid and objective measure of a patient's condition. Now, how do we apply this in practice? For a score of 0 to 1, the patient is considered low risk and can usually manage as an outpatient. A score of 2 indicates intermediate risk, suggesting a short inpatient stay or very close outpatient monitoring. For scores of 3 to 5, the patient is at high risk and inpatient management is strongly recommended. With higher scores often necessitating ICU admission, this framework helps us allocate resources effectively and ensure patients receive the appropriate level of care. In summary, the CURB-65 score is an invaluable, quick and effective tool for assessing the pneumonia severity. It significantly aids in determining the appropriate patient disposition and optimizing resource allocation. However, it's crucial to remember that while CURB-65 is a powerful guide, it should always be used in conjunction with your clinical judgment and the patient's overall presentation. Thank you for your attention, guys. Please like, share and subscribe to the Docsaab's diary.